You're listening to Nurse Converse, presented by Nurse.org, a collaborative podcast amplifying diverse nurse voices. Get ready for a dose of inspiration, a sprinkle of education, and a whole lot of community.
Hi, my name is Kasey, and I'll be your host for this week's Nurse.org Nurse Converse podcast. Everyone knows a nurse, maybe your sister, best friend, neighbor, the person you text random rash pictures to. Nurses are everywhere, practicing in a variety of specialties and healthcare settings. Nurses have been said to be the heart of healthcare, and the public called us heroes during the global pandemic. But do you truly know the nurse? In today's podcast, we will be exploring the evolution of a nurse, nursing student to seasoned professional. I'll be chatting with 3 nurses about their journey in the profession. The good, the challenging, and the funny. My first guest is Rakaya Moore, a 3rd semester nursing student with just 1 more to go before she sits for her NCLEX. She has a previous degree in public health and looks forward to specializing in women's health as a new graduate nurse. So welcome, Rakaya.
Happy to be here.
So the first thing that I want to ask you is, what brought you into nursing?
Well, if I can be 100% honest, pregnancy, work, an old memory, and a prayer.
Okay, I love that.
I know. It's a wide array of things. But the place that I was working at previously was a public health organization. It was a hospital organization or association. And I found out at the same time that I was pregnant, and the job was all related to maternal health. And so in the midst of me having that experience, being pregnant, going to work, I also had a midwife, and everything kind of came together at the same time and made me realize that I was supposed to be in nursing. And I had a flashback to this old memory of my grandmother telling me that I should be a nurse when I was about 18. I didn't want to be a nurse at that time. I thought I wanted to be in journalism, which was like totally different from healthcare. But when I really started to think about it, pray about it, think about my experience and the amazing experience I had with birth and with work and everything, I knew nursing was my calling. I knew I was supposed to be there.
Oh, that gave me chills. That literally gave me nursing is my calling. Oh my goodness. Wow. Well, we are so fortunate to have you joining the profession, because that's what we need. That's what this world needs. We need more people who really truly believe in the vision of the profession. So big question. And as a nurse educator, I'm super passionate about, mentoring and teaching our next generation of nurses. Do you feel thus far, because I know you're only going into 3rd semester, do you feel like your nursing education thus far has prepared you for clinical practice?
Absolutely.
Snaps.
Yes, I do. Even though I'm not in practice yet, because that is the goal, that is where I will be. I am going to be a PCT, and I feel like my clinical experience has absolutely prepared me. Everything I've learned, my education has absolutely prepared me. I think back sometimes to when I am in clinicals or like even in starting working, and I start to do my head to toe assessments, and I'm communicating with the patient, and I'm thinking, oh my gosh, I've learned so much. And I'm so grateful that I've learned so much, because it comes back to me when I'm with the patients. One of the things that truly sticks out to me the most is probably the spiritual and cultural aspect that we've learned in our nursing education. Of course, all of the other pieces come together, right? You know that you have to do your clinical pieces, your assessments, those things. But the spiritual and the cultural parts of a person have shown me so much about how you get to know the person first before you really start to implement that care. And so I'm paying attention to, okay, this person is not just a checklist. I'm not just checking the boxes. I'm not just giving medications. I'm not just trying to do the basic things to help them, breathe or walk or any of that. But I'm considering this person as an entire person. So I'm paying attention to, what do they care about? What do they believe in? What do they believe that will get them out of here? What will bring their spirits up? And it really is that underlying piece that we don't see from the outside, but it's all inward. So as a nurse, just thinking about those pieces of the person and how much that matters.
Yeah, that holistic healthcare that I think we use as a buzzword, especially like systems use as a buzzword, but what does that really look like for the individual? And I think, we lose that when we're overworked and we're short staffed. And I hate the word burnout, but when we're burnt out, I think we very much can't pour from an empty cup. And I think we lose that holistic approach to patient care that really is deep rooted in the nursing profession. And I do love that, your nursing school has provided you that lens, because I think that that's something you inherently have. You can't teach someone to be compassionate. You can't teach someone to be caring, and you can't teach somebody to look at that person and treat them holistically. The fact that you have that already, it just makes me believe that you're just going to soar to unrealistic heights, because it's such a core part of your person.
Thank
Of
you.
course.
And yeah, I think about that so much with that respectful care, cultural competency, all of that, things that we've talked about in public health that I realize are just, like you said, deep rooted in nursing. So I take all of that, I put it all together, and I'm just thinking, yes, I have to do this for my patient. I have to consider them holistically, as you said, and really mean it.
Yeah. Yes, of course. And that's the biggest thing. I can't stand fake, right? Like, you got to keep it real. And people know when you are just going through a checklist versus actually taking a pause, stopping whatever you're doing, looking at that person lying in that bed and actually talking to them. And I think that is what really, and you can teach anybody to do an assessment. You can teach anybody to do a med pass. It's really not that hard. But you cannot teach a person to meet that person as an equal and really hear what they're saying. And, I don't even think I'm really that great of a bedside nurse. I just think that people love my presence, right? Like, I'm just authentically who I am. And I take that extra couple minutes to hear them and meet them where they are.
Yeah, that's important.
It's so important.
Which makes you a great bedside nurse.
Oh, tell me more. No, I'm just joking. That's my love language. Words of affirmation.
I got you, girl.
Oh my goodness. So my next question is about mentorship. So this could be in a formal or informal, situation. How has that played a role in your journey?
So when I think of mentorship, it's kind of funny because I think I have a lot of like secret mentors. Like, I think people don't realize that I'm their mentee and I haven't signed a contract with you, but I am your mentee. So I hope you know that I'm just going to like really look to what you're doing. But I really value learning and just learning from people, hearing their advice on a subject matter. I'm always very reflective, always thinking about what did I do, what could I learn? And then how could I hear what somebody else told me and try to implement that in the best way. I know I had a mentor that was at my previous job, and she was a nurse. And I remember just kind of learning like evidence-based practice from her and understanding she was a really big advocate for nurses in general. And so really understanding like, oh, this is what the nurses are doing. And so hearing that made me become a better advocate for the people I was working with, because she was telling me what was going on. Or being inspired by my midwife. To me, she's a mentor. Being inspired by my clinical lab instructors, by the people I've worked with. Yeah. Just the people in my circle, I've just been really inspired by them. So I'm always paying attention, listening, hearing other people. And also realizing that mentorship doesn't mean that the person always has to be older than you, but also realizing that it's a lot about wisdom. It's a lot about what a person may have gone through in their experience that may not relate to what I've gone through. So I can see, they actually even mentioned this at my church. They mentioned that you can have a person who's younger than you, who's the same age as you, and somebody that's older than you, who should always be a mentor to you. So even in nursing school, there are a lot of people who are younger than me, but I realize the experiences that I may have had might not align with what they're going through. So I can hear them and pay attention to them and find them to be wise. I can find people the same age as me to be wise, and people that are older than me as well. So I think mentorship really is about the character of the person and just their wisdom. And for me, if I can see that your character is great and you're very wise, I'm going to pay attention to you. And I'm going to automatically think like, you have mentor capabilities. I'm going to listen.
You're a
That's gonna be a
sponge. You're
stuff.
like, I'm
Like,
just going to soak it all in.
I'm going to soak it all in. I'm going to take it all. So,
Yeah.
I mean, mentorship to me is really big, even when people don't know that I'm their mentee.
Thank you so much, Rakaya, for joining me today. It was a pleasure to hear your story, and I can't wait to see where you end up.
Thank you.
My next guest is Michael Pratt. Michael graduated nursing school in August of 2023. He is currently employed as a new graduate nurse at a local Baltimore, Washington area hospital in the emergency department. So welcome, Michael. So let's get started. My first question for you is, what brought you into nursing?
Well, I really just wanted a job where I felt great meaning in it. I wanted a job where I could pretty much go home at the end of the day and feel good about what I was doing. And really it all kind of leads back to me thinking, what do I kind of want to think of my life as when I'm really old and looking back to what I've done. And with all the jobs that I was doing, like I was a tree climber, I did like holiday lights for a winter and stuff. I didn't really see much fulfillment in that. I was kind of thinking, okay, like I'm probably going to hit 55 or 60 or, 80 and just look back and be like, I've kind of wasted my life. I haven't helped anybody. I haven't done anything worthwhile. And I didn't really want that to happen. And nursing is so far, even just as a new grad, a couple months in, it's brought me quite a bit of fulfillment. And I could say I've made a positive difference in many people's lives. So it's pretty rad. I really like that part of it.
That's awesome. That is so like self-reflective that you thought that far in advance. Like, what do I want for my life to say? Like, what impact am I going to leave? The foresight in that is, I mean, at your age, not to put you on the spot, but at your age, like that is mind blowing because I don't know if I've ever thought that far in advance and been like that deeply self-reflective. That's awesome. So thank you for joining us today, but also joining the profession. I feel like, you're one of those students that I can't wait to see where your future takes you. And being as that, I used to be one of your instructors. Do you feel like your nursing education prepared you for practice?
Oh, absolutely. I think I went to probably the most well-rounded and possibly one of the more difficult nursing programs in the state, and probably for a good reason. I mean, we just went over and we said that we had like an 100 NCLEX pass rate, and I think it's because like we were just trained really, really well. I had the advantage, and I didn't share this during nursing school, but I really had the advantage of kind of skating by on the GI Bill through nursing school. So I was getting the government check and going to school and focusing 100% of my efforts on it. And I just had all the time in the day, and I would just sit down and start the day. I'd study, and I'd end the day and prepare for the tests that would, the anxiety would build and build and build, and then test day would come, and the tests really closely mimic the NCLEX. And now that I'm finally in practice, I feel like a lot of the topics that we covered in the med surg classes and the psych classes, they're all really, really applicable to the emergency department.
That's awesome to hear because I know so many people get so caught up in like, the test taking, it's a struggle. It's a learning curve when you're new to nursing and to this profession. The fact that you can see that the knowledge you learned and were tested on, you actually used in your clinical practice. Like, I think that's everyone's goal that's in nursing education is to say like, you got something out of it, right? Like you can see the difference that struggle kind of made in your clinical practice.
Yeah, absolutely. And I'm definitely still missing a lot of like the street smart side, but I feel like my program made me like 100% prepared on the book smart side, if that makes sense.
Yeah, for sure. I mean, the goal is being a safe and competent nurse. And I think that that's really what the nursing education should focus on is producing new graduates who are safe and competent at the bedside. I think that is literally our only job. And the street smarts, they come a time, right? Like, and in the ED, you're getting a crash course in that
Yeah.
because you're getting patients from all walks of life and you're seeing a lot of psych patients, probably a lot of lovingly referred to as frequent flyers, people who kind of use the emergency department as like primary care, maybe a little bit of urgent care. You're getting a crash course in knowledge because you're just seeing so much in such a short period of time.
Yeah, it's quick, but I kind of like it that way, where it's like, and some days I'm over on the urgent care side, and I even really enjoy that because for the most part, they come in and we give them a quick treatment and we send them on their way. It's
Lickety
nice.
split.
Yeah.
So how has mentorship played a role in your journey? It could be formal mentorship or informal.
So both have kind of played a pretty big role. Informal, like there's just so many leaders that have been around, both in the emergency department through education. I mean, I looked up to you, Savi and Shayna the whole time I was in nursing school and was just like, when we first came in and you see like those and people in scrubs and you see Dr. N in scrubs and stuff like that and you're like, okay, like eventually I want to be that right there. Like I want to be this confident nurse that knows what they're doing, so much so that they're able to teach others. So even just like the confidence and what you all brought to the table, like that right there in and of itself is just leading by example. So that right there definitely affected all of us. And as far as like formal mentorship goes, my preceptor for my practicum for the ED, she I don't know if I'm able to say her name, Sarah, but she was very, very good at just kind of teaching me like what's up with the ED. Like I mean, I remember my first day there. It was within probably the first 10 minutes we had a cardiac arrest come in, and yeah, and I went from, being straight up nursing student there to not really knowing what I'm doing to bagging a cardiac arrest with a Lucas on, like 0 to
Wow.
100. And she's
Oh my
like, this is what the
goodness.
ED is. Yeah. And I was like, this is insane. Like,
Oh my
so
gosh. Well, no wonder
yeah,
you like fell in love. Jeez, a
yeah,
whiz. That is
yeah,
really a crash course. Oh my goodness.
yeah.
That gave me
So
chills.
yeah. But yeah, it's like, okay, this is what the ED is. Like it is, you are hanging out and everything is fine, and then all of a sudden everything goes insane and everybody comes and helps out and it's like a strong team environment. So she really showed me that and she taught me the ropes. And I feel like she's still teaching me the ropes because every once in a while we'll be on the same in the same pod and she'll kind of like look over and I'll know that there's something I'm missing. There's like something that I should be doing that I'm not. And I'm like, what am I doing? What am I doing wrong? You know?
Preceptorship, like, I don't think people realize, especially nursing students, I don't think they realize how important preceptoring is, like the preceptor role, because we don't really talk about it a lot in like nursing school. And really, we don't even talk about it a lot in the nursing profession. But honestly, a preceptor is a mentor and it can really make or break how you take on the nursing profession. The fact that you had someone that looked out for you and like gave you, the street smarts or like provided you with that knowledge, like that is everything. It sounds like you had such a great experience, like welcoming you into the nursing profession. And that's what that like preceptor is. I've always valued my role as a preceptor. I always kind of explain it as like a safe harbor, right? It's like this non-judgmental, safe place where the learner knows that you have their back no matter what, right? And you're patient, and essentially you're a mentor, right? Like you are what that new graduate nurse is looking up to. You're a role model, and it's crazy because to be a preceptor at many institutions, you don't even need to have been there very long, right? You don't need to have met any certain qualifications or training in educating a new graduate nurse. So it's such an integral role. And I just don't think that a lot of people who do it realize the impact that they're making on new grads in general. It's crazy. It blows my mind.
Absolutely. And it's like a lot of that kind of stuff, even just leading by example, like even just being a strong presence on the unit, like of where everything seems chaotic and you're looking at the track board on Epic and you're freaking out. You're like, I've got a billion things to do right now. And then all of a sudden beside you is cool, calm, and collected, whoever.
Right.
And they've got a billion things to do, but they've got the priority list in their head and they're just going through them. And it's like, I need to be that, I need to chill out. Got to do what I got to do.
It's crazy. In the blink of an eye, you will be that. That's really like the progression. Like you're having this conversation with me today, but in a year, you will be precepting that next new grad, making or breaking their way that they enter the nursing profession. It's kind of crazy to think about that.
It's pretty crazy. It's kind of heavy, I
It
hope
is
I do a
heavy.
good
It
job.
really is. It is.
Yeah.
But I know you're going to do amazing. obviously, but it's something to look forward to though, right?
Yeah, absolutely.
So far as a new grad nurse, what has been the most challenging thus far?
There's a couple challenges. I mean, the bureaucracy of the hospital and healthcare as a system is always kind of challenging. Whenever the system is failing somebody and there's nothing, it's just like you kind of feel powerless. That can be difficult. But I mean, one thing that's kind of specific to the emergency department is whenever I do get a priority list in my head, like for example, I mean, this one guy that I had come in, he was in DKA and he had new onset AFib RVR. So he had a lot of stuff going on, and I was just like dumping stuff into this guy. Like, I mean, he was on the DILT drip. He was just given all the things, and then the orders just flying in. The intensivist is getting involved from upstairs, and then he's dropping orders as well as the ED doc, and I was super overwhelmed. And then over in the other room, there was this woman that had peed her bed, and apparently she was on the call bell the whole time that I was in this room with this guy. And she was like, "Hey, I need to use the bathroom. I need to use the bathroom." And then once I finally got him squared away, then I go into her room, and you just feel really just cruddy. You're like, I know, like, I'm so sorry. Like, I literally could not make it in here. And they're pissed, and they have a right to be pissed, Like, I get it. And I don't feel it's right to kind of explain, like, hey, like, that dude over there was dying kind of thing, and I couldn't make it in here. Like, somebody should have had time for you. Like, we should have had a tech or something that was floating around and able to come in here and help you out. But so that part's tough.
Yeah. And it's really hard when you're learning that as a new nurse that you can't be everything for everyone all the time. And that you have like this prioritized list in your head, and then the shift progresses, and all of a sudden you had this one finite list, and now you're making all of these curves and pattern changes that you didn't really anticipate for. But I think, just being humble and just apologizing goes a long way, which I'm sure you did, but also not throwing anybody else under the bus, right? That's really difficult, especially if you want to be a team player. But you're right, like somebody else could have helped that patient, So don't take it, it's not your fault. Maybe a little bit of a teamwork issue, but it happens to the best of us for sure.
And it is also like on me in that regard. Like looking back, I probably should have gone to somebody and be like, "Hey, like I got this going on. Would you mind going in there and helping her out real quick?" Like I
Right.
could have done that, but
Yeah.
in the moment, I wasn't thinking of it. I was like, "Okay, this guy's gonna die. Like I need
Yeah.
to." Yeah.
Yeah. And you're human, right? You're overwhelmed. This is new. Like that's crazy, And hopefully somebody could have recognized that as well. So when you play it back out, like there could have been a million different scenarios. Maybe somebody would have recognized you needed help or you asking for help. I think that's important that new grads know that, sometimes us seasoned nurses, we kind of get like blinders and we're just like doing our own thing. And unless like you literally say like, "Hey, help over here," like we're just doing our own thing. So just kind of a reminder to the new grads out there, like ask and it will be done. Thank you so much for taking time.
Thanks for so much for having me on.
My next guest is Shayna Skeffrey, a local med-surg nurse who has been on the front lines during COVID. She is also a nurse educator at an accredited nursing school. She started as an LPN and now has an MSN in nursing education. Shayna has been a nurse for 9 years. So let's talk more to Shayna and find out how she did her nursing journey. So first, Shayna, what brought you into nursing?
Hey, so what brought me into nursing? I remember when I was younger, my godmother, actually, she passed from cancer. And I remember the drainage from the wound dressing that she had. And I remember, like, who's going to change it? What does that smell? Like, how can I help? And I realized the nurse was supposed to come and they couldn't come because of the weather. And I just was like, I can't wait to one day be that person that could actually help and like change that dressing and make that difference in her life, because I knew it would have made her feel much better. But waiting on somebody and just being that for my family would be amazing.
Wow, that's really cool. I actually didn't even know that about you. So do you feel like from your nursing education experience, I know you started as an LPN and then you transitioned to your RN to BSN and then essentially your MSN. Do you feel like your nursing education prepared you for bedside practice?
I could honestly say I think my LPN prepared me more than my RN, but I think it's because when I did my LPN, it was completely brand new to me. So I felt like I had to be that sponge for my LPN. I feel like my clinical instructors and things were a lot more stricter and their expectations were a little bit higher for me. I don't know why. Maybe just because nursing was just completely new for me at that time. So I think my LPN better prepared me, but it depends on the instructor, the professor, your interest, like what really spoke out to me during that journey.
I know you've talked about how tough like LPN school was, and I think that you're right. It's like that initial fire hose moment where you are literally being thrown into this situation, and it's a new language, it's a new lifestyle. Everything about it is new, and it's so scary and can be really daunting too, right? Like you don't know what you don't know. So, my passion about mentorship, do you feel like you had a mentor in your journey, whether formal or informal, that's kind of played a pivotal role into your success as a nurse?
I feel like every chapter in my journey, I had a mentor that played a different role in the different person that I was in each chapter of my life, whether it be in LPN school, being completely different. It was actually my aunt that was my mentor because as a first generation graduate of college from my family, my aunt, I was able to do things that she wasn't able to do with what she was provided with coming from a different country. So being able to live her dream and for her to support me, whether it's a good meal, food is my love language. So whether it's like a good meal before an exam or like helping me put on a blood pressure cuff at home or something like that. And then as it transitioned into the clinical aspect, I had my educator that became a huge mentor to me with the different chapters of the different things I wanted to do, like going back into nursing education. She was there for me. She helped me choose the right scholarships. Me and my anxiety, she helped me with that, like trying to calm down. And then getting into nursing education, there's amazing women that were placed in my life that really helped me navigate being a novice educator.
Yeah, I think the same. I just love the fact that our profession is predominantly women. And I know that there's some pros and cons to that, but I feel very blessed as well to have met some really powerful women from all kinds of diverse backgrounds, different stories that they've been able to share with me. And it's probably been one of the most rewarding parts of being in the nursing profession for sure. And that includes you.
Yeah, same. I could not have done it without you. Like starting and seeing smiling face and giving it to me real. She's a real girl.
That's for sure. So I know bedside nursing has its challenges, and we discuss this offline all the time about how hard it is right now. We make jokes about it being like the Wild West. But what do you think has been the most challenging thing that you've had to overcome in your bedside journey so far?
I think the only thing that really pops up to me now, because I guess it's still fresh. I don't care if it was 3 years ago. It's still really fresh. Throughout my 9 years, I think COVID and the pandemic was like, I still consider myself a baby nurse. I don't know why. Even like years is just time. But I think the pandemic really gave me a reality check of what nursing was and what it means to me and what it means to the care and the bedside care and the education that I am meant to provide in this world. It was scary. It caught me off guard, but it made me who I am today, that I can sit here and just talk on a podcast and just feel more confident in myself. But I saw a lot of things that I didn't want to see, but then I got to experience the love and the support that bedside nursing really does have, whether it be your mentor, whether it be your peer, your coworker, whether it be that new grad that's starting during the pandemic and you're teaching them in a different format. The pandemic really opened my eyes, gave me a different lens to nursing and how much it meant to me.
I would definitely agree with you. I did bedside nurse during COVID. Mine was a little bit different because my unit wasn't set up to take COVID patients at the time. And I know that you kind of got thrusted from a general med surg unit to being kind of thrusted into this new role as a COVID nurse. And COVID was so new. It blew our minds. We knew nothing about it when you think about it in scientific format. Like we really didn't know anything about it. And the fact that you didn't really actually have a say in providing care for those patients. Not that you wouldn't do it, but it was really kind of thrusted upon all of us in the healthcare profession. It wasn't an option. We couldn't not go to work. We couldn't not provide care for these people. I'm super
And
proud
it's
of
the
you.
beauty of it too. It's it's almost like I became a new grad all over again, because it was just like, oh, this sounds interesting. I'm going to do it. I'm going to, like, it's just another sick patient. It'll be fine. Everything will be fine. You know, the world is burning, but we're great. And then it was just like, wait, someone's going down. Wait, they're no longer here. And it was just like that cycle of like emotions that come along with it. And then you have to actually deal with going home and like dealing with your family members going through things, and you leave it at the door and you walk into the hospital and you smile the best you can behind all the layers of mask and shield and just do what you have to do.
I think the scariest thing was the fact of going home, right? Like, I was terrified to see my mom and my stepdad because they were part of that like vulnerable population. And that was really hard for me. Like, I remember like kissing my mom one time and I was like, oh my God, did I just give my mother COVID? You know, because we just didn't know, right? Like, we would, every other day we'd be getting notifications that a patient we were taking care of popped positive for COVID, which is a different world. I think that nursing in a post-pandemic hits different. I think, you know, we've had the luxury of seeing pre-COVID and post-COVID, and there are some things obviously systemically that needs to be fixed. But I also do agree with you that it has really brought the profession closer together. And I think that's been one of the most rewarding things I've seen. So that kind of segues into the next question. What do you think in your nursing career has been the most rewarding?
In this chapter of my life, I think nursing education has been very rewarding for me in the growth that I am going through now personally, setting boundaries, loving myself, that imposter syndrome, because I always look way younger than I am. So I don't always feel like I fit in spaces that I'm placed in. And the fact that students will look me in my eye and like trust what I have to say. It's different when a patient is, you know, they're sick and you're like, okay, this is what I learned and this is what I'm going to do. When a student looks in your eyes and they trust you, and then you go to the pinning ceremony and you watch them walk across the stage and you pin them, and you're like, you did that and you supported them do that, and then you became the mentor, like that cycle, that journey, that now you are that person that was for someone else. I think it's quite amazing. It's very rewarding. Makes me happy.
I look forward to the nursing future, and I look forward to seeing how that looks for us all, really. So thank you so much for coming.
Thank you. Love you.
Thanks for joining Nurse Converse, brought to you by Nurse.org. Help us grow by leaving a 5-star rating and review on your favorite podcast platform. Nurse.org supports nurses with career and education tips, life advice, and breaking news. Thank you for all you do and for being you.